Afternoon, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system, try and make a better system for all of us. We have a lot of scientific updates today, so let's get started. Before we do, let me point out down below in the YouTube description box is a link to the Healthcare Advocacy newsletter. That is the text for today's video, and all of the background material, references, studies, and the like are all in there. Okay, cancer news. Immunotherapy has revolutionized the way we treat cancer in recent years. Instead of targeting the tumor, immunotherapies work by directing patients' immune systems to attack the tumors more effectively. This has been especially impactful in improving outcomes for certain very difficult to treat cancers. Still, fewer than half of all cancer patients respond to current immunotherapies, creating an urgent need to identify biomarkers that can predict which patients are most likely to benefit. That would be great, right? Scientists recently uncovered why cancer patients with the ARID1A gene mutations are more likely to respond to immunotherapy, discovering that those mutations invite cancer-fighting immune cells into tumors by triggering an antiviral-like response. Their findings could help improve cancer care and drug development for many cancer types, including endometrial, ovarian, colon, gastric, liver, and pancreatic cancers. The new study was published in Cell, the magazine, on May 15th in 2024, and it reveals that those particular mutations render tumors sensitive to immunotherapy by inviting in, as I said, cancer-fighting immune cells into the tumor through an antiviral immune response. The researchers suggest that this mutation and antiviral immune response could be used as a biomarker to better select patients for very specific immunotherapies, like immune checkpoint blockade. Anyway, so let me point out to you, in the newsletter is a link to the Science Daily article on this. The next one I want to talk about the next topic has to do with dementia. A group in Germany used group training to address cognitive decline. So let's talk about it briefly. Solving a quiz as a group while moving around a room all at the same time, this combination of activities is the basis of a new tool designed to prevent dementia. Researchers in Germany developed and evaluated it in what's called Go4, the number 4, Cognition project with industry partners and brought it to market maturity. The new system is designed for groups of 7 to 10 people. They have 6 stations set up around a room, each equipped with a tablet, computer tablet. The tablets display different tasks like list German chancellors, because they're in Germany, memorizing series of numbers, planning a trip around the world to specific locations, all kinds of things. In order to complete the tasks, a participant has to move to the relevant station, insert a baton fitted with a microchip into a specific device. Everyone has their own baton, so individual performance can be measured. The researchers tested the system with about 30 volunteers between the ages of 60 and 89 who had already been diagnosed with mild cognitive impairment. That is, they showed moderate cognitive impairment in neuropsychological tests. The participants are not restricted in their everyday activities, but have an increased risk of developing dementia at a later stage. So they're already in trouble, okay? The participants trained with the Go4 Cognition system 2 days a week for 6 weeks. So that's not very much. After completing the training, get this, 70% of them were no longer diagnosed with mild cognitive impairment. That's just outstanding. Anyway, there's also a link to the Science Daily News article about that. Treating opioid overdoses. This is a news story, just got cheaper. Walgreens is getting ready to offer a cheaper version of an important opioid reversing drug at its stores shortly, according to their press release. Walgreens announced it is expanding access to an over-the-counter life-saving medication with the launch of the Walgreens brand naloxone hydrochloride nasal spray. Read the press release from Walgreens Boots Alliance, that's the parent company. It should be available over the counter without a prescription in many states. However, some, not in all. Some states require a prescription, some require training before the sale. Ask at the pharmacy and they'll tell you how to get it. If there is an addicted person in your sphere somewhere, it is just prudent to keep it around. Okay, reversing vertical integration. We have talked about vertical integration several times, and it is like the bane of the healthcare system. Anyway, insurer ownership of clinical practices is distorting U.S. healthcare, enabling profit-taking from government funds, patients, and independent providers. A new report outlines policy and regulatory actions to reverse these trends, consistent with Biden administration antitrust philosophy and with single payer. This was reported in the Health Justice Monitor, which I heartily recommend to you. The Federal Trade Commission and the Department of Justice are now pursuing some antitrust behaviors in the healthcare marketplace. We've reported on some of those in the past. The author of this report identifies the way that the government pays for healthcare is actually part of the problem, and 3 policy recommendations are described to repair the system. Number 1, combat corporate consolidation and elevate the power and autonomy of clinicians and their patients. This could be done by strengthening antitrust enforcement and by prohibiting insurance company ownership of providers, similar to the New Deal era legislation that was called Glass-Steagall that was implemented for banks at the time. We could use public utility regulations to foster healthy and fair competition. Currently, not done. We could use public funds more responsibly to build and deploy healthcare resources. This would make healthcare more available, especially in medical deserts. I know people who read our newsletter and who watch our videos, you know what, we're activists in the healthcare world, many of us for universal single-payer healthcare insurance. But even if we had it, some of the provisions I mentioned above wouldn't be addressed. Let's ask our member of Congress and our senators to read the report I mentioned above and consider legislation to implement the recommendations. If you go to the actions down below or in the newsletter, you'll see I've put in the full URL of the report. And of course, there will be a link so you can call or email your representatives or senators, or you can use ResistBot on your cell phone by sending a text message to 50409. Here's the message: sign, SIGN, PNTQKP. That's sign, SIGN, PNTQKP to 50409. And you'll just tell them, I'm your constituent. There's so much wrong with the healthcare system in the United States. We need to fix so much of it. But part of the problem is that companies are really incentivized to vertically integrate into near monopolies of networks to increase profit instead of delivering timely and effective care. Universal healthcare fixes some of the issues, like in HR 3421, but other consolidation issues require more antitrust type attention. And I'd like you or your staff to read the report, and of course there's a link to it, and take some of the actions regarding the recommendations that are in there. And of course there's a link to the report. Thank you. We always try to say thank you. I have one more article for you, which is more biology related than healthcare. It's Nature Fooling Nature. It's not really healthcare, but I always enjoy stories about how a species is set up to protect itself from prey. I read that when tiger beetles hear a bat nearby, They respond by creating a high-pitched ultrasonic noise. And for the past 30 years, no one has understood why. A new study, scientists discovered that the tiger beetle uses ultrasonic warning signals that mimic those of toxic moths so that they don't get attacked because it looks like they're poisonous. Just extra cool. Okay, before we sign off, I want to point out to you, if you're looking over my shoulder, those peonies were grown in my backyard by my wife. Pretty cool, huh? Okay, down below, Healthcare Advocacy Newsletter. You can also like, share, and subscribe. You can sign up for free to the Healthcare Advocacy Newsletter. Pass it around, take the action, be a good advocate. Talk to you soon.